Hello, everyone, and welcome to our 2025 PKD Summit. My name is Micheli Goodfellow, and I'm the Communications and Engagement Manager for the PKD Foundation of Canada, which is the only national organization solely dedicated to fighting PKD through research, advocacy and awareness, and education and support. This session is on the topic of emergency preparedness for PKD patients. And today we have panelists from BC Renal with us to talk about how severe weather events, natural disasters, and other emergencies can impact PKD patients, especially those on dialysis or post-transplant. We will have a live question and answer period towards the end of the event. We'll have a little bit of a roundtable discussion. So if you'd like to put your questions in the Q&A area or in the chat between now and then, we'll try and address as many as we can. The session is being recorded and it will be available to view on our YouTube channel in the coming weeks. So I'll now introduce our panelists today. Dr. Mike Bevilacqua is a nephrologist with additional training in health administration. His clinical nephrology practice is based in Surrey, BC, and he's involved in several administrative roles with BC Renal. He's the chair of the Provincial Kidney Care Committee, which coordinates multidisciplinary care delivery for over 15,000 British Columbians living with chronic kidney disease. He's the medical lead for the BC Polycystic Kidney Disease Network, which aims to optimize management of PKD in BC. And he's the co-chair of the Transplant First Committee, aiming to improve access to living donor kidney transplantation. In addition to these clinical administrative roles, Dr. Bevilacqua is involved in research and specific interest in the care of patients living with polycystic kidney disease, knowledge translation, systems improvement, and evaluating care delivery. We also have Sarah Thomas. She's a project manager and renal nurse specializing in emergency preparedness and response, with experience in coordinating emergency operations, supporting disaster planning, and strengthening community resilience. Sarah focuses on ensuring readiness before, during, and after crises. Skilled in risk assessment, continuity planning, and provincial collaboration, Sarah works to improve preparedness strategies that safeguard patients, staff, and resources when emergencies strike. And finally, we have Naomi Martens. She's been a renal nurse since 2007 and has worked in hemodialysis, peritoneal dialysis, and pre-dialysis clinical areas. Currently, she's part of a provincial team of hemodialysis nurses called Hemodialysis Emergency Support Team. These nurses can be deployed across the province to help provide or organize dialysis for patients when a disaster has disrupted hemodialysis services or access. Naomi also has an interest in preventing disasters due to climate change and is involved in planetary health committees in her healthcare systems. So welcome to all three of you. We're going to start with a little bit of a slideshow, and Sarah and Naomi will be speaking to that, and then we'll finish up the session with a roundtable discussion. So Sarah, if you'd like to go ahead.
Hello, everyone. Thank you so much, Michelle, for that wonderful introduction. We are thrilled to be here today from representing BC Renal, and Mike, Naomi, and I work closely together. So we'll definitely have some time at the end to answer any questions, and we're thrilled to be here. Thank you for inviting us. So I'm going to talk a little bit about emergency preparedness, and more so about some of the big emergencies we've seen here in Canada. We know that we've had multiple emergencies, and many of you have actually probably, if I think back to the last 20 years, probably have lived in some sort of crisis response or working to better support your communities. So I hope some of this will resonate with you, and I'll just move my slides along if I can. Okay, sorry. So I just want to sort of start the presentation basically talking a little bit about how climate events affect kidney health, and in two different ways, both directly and indirectly. We've probably noticed that, or you may have noticed that the summers are getting hotter and we're having more and more heat waves, which our heat waves can cause dehydration, maybe making your kidney function worse, increasing pain or cyst bleeding. We're seeing more floods and wildfires and storms that can cut access to care and medications, or power. Smoke and poor air quality can trigger inflammation and fatigue. And definitely anyone who's on some sort of home therapies or even some home medical devices or refrigeration for certain medications, if we have power outages longer than a few hours, that can really impact that. I do want to highlight that emergencies may disrupt care for days or even weeks, especially when it comes to power outages. We know that our hydro teams work around the clock to get hydro back on. However, it can take quite a while. So, and if infrastructure is impacted, we're really struggling to make sure everyone gets the care they need. So I thought I'd start off with a little bit of history and look at some of the big climate emergencies that we've seen around Canada. The first one being in 2021, Western Canada had a heat dome. And if you do live in the western part of Canada, you will remember our heat dome. It was extremely hot. Many lives were impacted because of this. Power went out, which was a struggle for our air conditioned areas. You can see in this bottom picture, this is a cooling center where people could go to get to cool off. Power grids were stressed due to this temperature and blackouts affecting many things. So medication could be a real important thing to think about if you do experience a heat dome. Insulin and certain prescriptions can definitely be compromised by heat. And of course, dehydration is a big risk to our kidney patients. Some of our patients are on a fluid restriction, and then exacerbated by the heat and dehydration, it can really cause it can really be detrimental. So in 2021, we had the heat dome. In 2021, the same year, out here in British Columbia, we had a Pacific Northwest flood that impacted the region where both Naomi and Dr. Mike live and work. And we had quite the atmospheric river. You can see from the top picture here, many of our highways were actually washed out, and patients could not get to their dialysis treatments or appointments if they had appointments with their physicians or their healthcare teams. We also had a major bridge coming into what we call our lower mainland here in Vancouver, where many of our larger hospitals are. So a major bridge in the interior of British Columbia was washed out. And that's one of the major bridges that our supplies are delivered by. Even our gas, we had a gas ration at that time. So it was quite a devastating flood. Nothing that any of us have seen out here in British Columbia. And I think Naomi might be able to speak a little bit about her personal experience as a nurse working with patients during this time. But we did have power outages and service disruptions for many, many days. And we did have to redeploy patients who were on dialysis to different areas. Many of them were medivacs to more safe areas. So then we'll move back to Central Canada in 2022. You may remember this if you live in sort of the Quebec and Ontario region. This is Canada's derecho. And if you don't know what that is, it's basically like a tornado, but a derecho is not a circular wind. It's straight on, but it just as impactful as a circular tornado type wind. So it was very impactful. You can see from the bottom picture, many of the hydro lines came down, loss of electricities for up to a week in some areas. Clinics and hospitals operated under emergency powers, moving to like a generator. And it definitely delayed many appointments, and things had to be changed around to accommodate the sickest patients at that time. And of course, transportation communication networks were impaired, and it was really hard to communicate with a patients to make sure that they had everything necessary to be safe. So this was definitely something, and if you live in this area, you probably remember it. I know Michelle said she lived in that area and really remembers the impact of this disaster. And then if we move to Atlantic Canada, we might want to think about Hurricane Fiona came through, where we had power outages and limited access to our rural and coastal Atlantic areas. And many people and our critical infrastructure and treatments were impacted by this. Evacuations and facility closures forced patients to move at a short notice. And or if our dialysis patients, they had to relocate to a different dialysis center who was unfamiliar to them, but it was in a safer area. So it definitely impacted them. And then it really impacted medication delivery and transports for supplies and our essential medical supply chains. So this was a big disaster that happened in Atlantic Canada in 2022. And then if we go back to Central, you may remember this was over Christmas in 2022. The Christmas sort of blizzard is what they called it, where the airports, I know Pearson was shut down, and many of the airports in the area, patients and families were very upset because they couldn't connect over Christmas. Some people were stranded. Some of our patients were even stranded in airports and didn't have the essential medications they needed. So it was very impactful, and definitely something to think about. What we also know is power was out, which made it very cold for some of these homes. And the risk of hypothermia and dehydration was definitely worrisome. Ambulances and emergency crews could not get to people, and it made it really difficult to reach that care. So that was in 2022. And then the last one I'm going to highlight is in 2023. We had the worst Canadian wildfire season on record, not just here in British Columbia, where we see wildfires every day, but Northern Ontario, Northern Manitoba, Quebec, more hectares of land was burnt and trees were burned in 2023 alone. And evacuation was a major issue. We had to evacuate many patients. We also had to, during this time, we had to evacuate all of Northwest Territories. And I remember being on call that weekend. We were looking to bring dialysis patients down from the Northwest Territories to British Columbia. And our airport had a mini hospital set up for receiving those patients that the Northwest Territories, Yellowknife was under fire. So, and I know other smaller centers and dialysis clinics, as well as people living with kidney disease, were highly impacted by this terrible wildfire season. We had poor air quality, and that can definitely aggravate health conditions and chronic illness. And again, the local infrastructure was damaged, and a lot of people could not get access to the care they needed. So I'm not trying to scare you with these slides, although it does seem a little daunting and a little scary. However, I do want to leave you with this. We have always been resilient, and we all come together when there is a crisis in Canada. So I don't want you to fear this. I just want you to be mindful that these things happen at a drop of a hat. We're not sure what and when it's going to happen. So being prepared is really the key to being safe in a disaster, in a climate emergency. So with that, I'm going to pass it over to Naomi, who's going to talk a little bit about being prepared. And I'm just going to advance my slide there.
Thanks, Sarah. Thanks for having me this afternoon. I'm just gonna go through here. This is one of the resources that we use here in British Columbia. And it is available on the BC Renal website. There's an emergency preparedness booklet. It is directed more towards hemodialysis patients, but there's some tools in there that are beneficial for everyone. You can see here one of the pages from the booklet is just some basic information that you can have on hand so that you can relay it to emergency personnel or healthcare personnel if you need to. It also, there's some good tips on the side there, making sure you have emergency contacts who understand your healthcare needs. One of the things that I do on a regular basis in my unit is I go make sure all my patients have emergency contacts listed, that they are up to date, that we have their address and phone numbers and that those are up to date because people move, emergency contacts change. So I make it a point to check in with my patients, but I also encourage them to let me know, or another nurse or somebody on our hemodialysis team let us know when those things might change. So if you do have a kidney care team, make sure they have your up-to-date information. That always helps in case of an emergency so that we know if people are in an area that's going to be evacuated. We can if we have up-to-date phone numbers, it's much easier to contact. We have a card available to our patients, but it's information that could easily be written on any piece of paper and carried around in a wallet, in your purse, just to let any emergency personnel who might need to treat you, what are some of the significant things that are pertinent to your medical history. So like I said, this template is available on our BC Renal website, but I know in my job, I have I've looked at a lot of resources online, and pretty much every government website, whether it be municipal, provincial, or federal, will have some kind of emergency preparedness tools on their websites that are available to people to use. And with templates, with things like your medical history or emergency contacts that are essential for you to have. So another important piece of information is to have all those phone numbers that are important to you. Know how you can contact your kidney care team or your nephrologist or your pharmacist in case of an emergency. And like it says at the bottom there, if you do have to relocate or evacuate for some reason, let your team know where you are at. Then they can either, if you have healthcare options where you have been relocated to, then they can address needs of other patients, or they can try to send things your way if necessary. I think we can go to the next slide. It's important also, medications are really significant for most kidney care patients, whether you have PKD or other reasons why your kidneys are not working. Medications are a significant part of life. So keeping a 2-week supply, if possible, is a good plan. I know medications can change from time to time, so making sure they're updated, and then having a list of your current medications. So again, keeping that updated. It does talk at the top of the list, there's some good points of knowing which ones are absolutely essential for your survival, and making sure you have your medications with you when you travel in your carry-on luggage, not on the luggage that's being transported elsewhere. And when medications change, making sure that your list gets updated. As Sarah was talking before, Extreme heat can affect medications, so having a place that's cool and dry for your medications, or there's those medications that need to be refrigerated. And if you've lost power, then you might need to have an alternate plan of having those medications refrigerated elsewhere, or having a cooler with some ice in it, or some kind of generator to keep power going to some kind of cooling device. Might be something that you think about in your emergency plan. Another point was to ask your pharmacy if they can transfer prescriptions. So communicate with your team. Let them know you're thinking about being prepared for an emergency, and see what they can do to mitigate any of those circumstances. You can go to the next slide. So this is a visual tool to show what would be emergency kit essentials. Definitely, like I said, there is a ton of options out there for lists or visuals like this, or different ideas of what you should have in an emergency kit. So there's some basics that are true for everyone that should be in an emergency kit. But then when you have chronic health conditions, there might be some things that are more specific for your needs particular. So those are some things that you need to plan for and think about. So this, like an emergency kit is significant to have in your home. There's also a grab and go emergency kit, so that if you have to evacuate, you have something quick with some very essential items in there. Again, if you go on any government website, they're going to give you lists of what those things are. And I think even on RBC government websites for emergency preparedness, they talk about specifically for people with chronic health conditions, what are some things that need to be, that would need to be taken into consideration. Some of the things that I have learned through this job, or experiences that I've had in my role as a renal nurse, is have a network of people if possible. So other people you know that have PKD or other kidney conditions, if you know of some in your area or your community, create a network with them. When I was working as a peritoneal dialysis nurse, and some of my patients were stranded because of the flood, they were running low on supplies, we were able to make some connections between them so that they could, some people who had some solutions that another person needed, they could exchange those out. And so I think having that connection with your healthcare team, but also having that connection with other people who are having the same issues as you, really provides you with support, and maybe even with some ideas of some things that you can be have at hand to be ready. I know even within our healthcare team, it was really significant to have all of us working together during that time during the floods, because some of my coworkers thought of issues that I hadn't thought of, or problems, solutions to different problems that I hadn't thought of. So having that network really is significant. Another thing that I think is really important is to talk with your kidney care providers about possible emergencies. Let them know that you're thinking about this. Maybe they have some ideas that you haven't thought of. Maybe they have some networks that that can maybe put you at ease, knowing that you can make some connections if need to, or it might make those healthcare providers think about having some kind of emergency or disaster plans in place, and networking with other communities, provinces, or even nationwide, having some kind of network to provide backup care for our kidney care patients if necessary. And I think that's those are my ideas.
So much, Sarah and Naomi. That's been a great start to thinking about some of the potential events that might happen across Canada and some of the ways people can be proactive and thinking about what they might do if different situations should come up. What I'd love to do now is have a roundtable conversation. And of course, if anyone who is watching has any questions about their own particular situation or the region in Canada where they live and they know they may have certain types of events, feel free to leave questions in the Q&A area or in the chat, and we will address those as they come. But Dr. Bevilacqua, thinking about PKD patients in general, we know, we can see from the presentation of Sarah and Naomi that of course, we need to be concerned about when we're on dialysis about how will we continue to dialyze, or if we're post-transplant, how will we have enough medication to stay to prevent organ rejection. But are there other things that people in different stages of PKD might not be aware of that they want to think about when they're thinking about emergency planning? For example, if a family has children who are affected by either AR PKD or AD PKD, how does that then change, what the caregivers are thinking about?
Yeah, so these are great questions, and I think there's a few specifics to PKD that's worth talking about. Especially in earlier stages, because that's where the differences really are. A lot of the concerns later on, like we had already heard, if you're on dialysis, the concern is how do you get to dialysis? If you're on transplant, the concern is how do you have continuity of your anti-rejection medications? But the earlier stage PKD patients do have some specific ones. And one of the items, for people who, for example, are treated with tolvaptan, is a medication, for those of you, some of you on the call might be on it or may not. It's a medication that, if anything, quite dramatically increases your water need. So the way it works specifically is to make you, urinate out a lot of water, so you'll need to take in a lot of water. So that's obviously going to increase the amount of needs you have there. And we do a few other things that sometimes might make people more sensitive to things like dehydration. For example, in our polycystic disease patients who are earlier on, we might have them have a lower blood pressure than a lot of other people might be aiming for. And this can be true for quite young people. And so why I mentioned those two items together is that's kind of a recipe that might make someone quite uniquely sensitive to dehydration, situations where they can't get to water, or also quite extreme heat. Naomi had mentioned earlier on or no, I think Sarah mentioned the heat dome, which we all still remember out here out west. And that's kind of the very extreme end of it. But, it's not unusual in a lot of places, as we've seen some climate, changes going on where you can routinely hit items or weather into the 30s, right? In the mid 30s, you just on a regular summer, forget a heat dome. And if you're on a medication that's making you dehydrated and your blood pressure we're aiming for is 100, that can hit you really, really hard. So my advice that I give about a couple of things there. I love the concept that Naomi mentioned in the emergency plan right there on medications. It said, okay, what's the essential ones? Or, sometimes the phrase I use with my patients, it's what's non-negotiable and what's negotiable. Like, what are the things that, you really, really must take every day, like an anti-rejection medication, versus if it's something like this that you might be able to back off on. And so the couple of big tips that I would give is, obviously you want to prioritize water access, but just like we might tell someone if you're really unwell, like say someone gets a cold or a flu and they're already getting dehydrated, we have the luxury of a few things. We'll say maybe don't take your blood pressure medications, because rather than aiming for a low blood pressure and we're kind of kicking you when you're down, when you're already dehydrated, back off on that for a couple of days. And then coming back to that, the treatment of tolvaptan, if you're taking that, that's definitely one where I would suggest people to stop at those times. So if there's extreme heat and you're already getting dehydrated, to put it in perspective, if people on the call, if they're not familiar with the medication, on average, someone who's taking that medication might have 4, 5, 6 liters of urine output a day and have to be drinking even more than that to keep up. And so if you're already dehydrated, that's far too much to take on. So, I would definitely be suggesting don't take that for a few days. Wait until things settle down. And same thing if you're in an emergency situation where access to water is impaired. The nice thing about all of those types of treatments, as opposed to something like an anti-rejection medication, is you do have the luxury where you can just stop it, a few days, whatever, until the situation settles out, and then pick it up again when the dust settles. And it's not like that's harmful to you. So that's I think probably the biggest concern for the earlier stage patients when everything's on an even keel. The only other item I would mention to add in, now this is true for everybody else, but specific to polycystic disease as well, is that there can be kind of urgent type situations that come out of the blue. If again, I'm not sure if those on the call have had one of these events, but for example, people can have things like infections or cyst ruptures or stones that can just bang out of the blue. And sometimes these things have a habit of happening at the worst possible time, like in this type of situation. So although it's true for everybody else, part of your emergency plan being to know, there's a lot of focus on how do I get to my dialysis treatment. Part of the emergency plan would also be, well, if one of these acute events were to happen, what's maybe plan A and plan B for where I could seek urgent care, just in case one of those items is no longer available to you, in that situation.
Right. Really great points. Thanks for that. We did have a few questions come in with registration, so maybe have a look at some of those. Someone's asking, can local governments or utilities be aware of the health needs of people in a particular community so that they can be prioritized? Or is there any kind of infrastructure set up to accommodate for that? And maybe I guess the answer would be, do you know in BC, how do you find those patients who need those continuity of care?
I
I was
can
thinking,
maybe,
perfect.
okay. Well, I know for our home dialysis patients, whether I know for home chemo specifically, we do alert the utility company for water, and we also alert our hydro. We use BC Hydro here in British Columbia. We alert both of those utility companies to make sure that if there is a water outage or a power outage in that area, these people would be notified first. So we do that already. Now, I don't know about other parts in Canada, and I can't specifically say for people who are in the hospital, there's backup generators. But for people at home living with PKD, I don't think there is a system to let infrastructure teams know. Dr. Mike, do you know of any?
I don't think there is, no. Now,
Yeah.
what I would add on to there, and you're exactly right, we do that, for home hemo patients in general. Also happens to be one of their hats I wear. I'm our home hemo lead here in Fraser Health. The other message I would give, though, although yes, you want to be prioritized, the message we definitely give to our home dialysis patients is that in that type of situation, if access to, water utilities is in question, even if you have it now, probably the thing you want to be thinking about is how do I get to a place where this can really be reassured or can be assured. Like, for example, our home hemo patients, actually the message at that time we often give is just like we do to our other patients, get close to where there's going to be dialysis treatments available. Because, if it's tenuous, yes, maybe you have it today, you might be better off getting somewhere a little bit more central today rather than tomorrow it happens to go out and you're kind of stuck. So we've had a lot of our during the and Naomi, I was gonna say maybe you could speak to this too during the floods, but actually we did specifically get all our home dialysis patients onto the same list of people that the facility-based dialysis patients were at, in terms of even if they needed to be evacuated into a location, we can get them their dialysis treatments.
Naomi, would you like to talk a little bit about some of those firsthand experiences you had during the flooding and looking after patients in that area?
Well, Yeah, I can talk about that. I'm just thinking of the previous question. The only thing I can think of is, and I like, if your kidney care team, like here in BC, we have our Health Emergency Management BC, and I don't know if we alerted them whether they could have some contact with municipalities to help arrange prioritizing people who are on some kind of home dialysis. I don't know if that's a possibility, Sarah. Sarah might know more about that connection with HEM. We call it HEM BC. But that's maybe one of the routes I could think about, making sure that people have access to, like, prioritizing access to water or power. As far as my experiences go with the floods, I think, like, I mean, there was definitely evacuations going on, people being transported from areas where they were didn't have access to roads that would bring them for dialysis. We had helicopter transport for those patients, brought them over to from Chilliwack, some of them from Chilliwack or Hope into Abbotsford. And there was prioritizing going on with those patients as well as to who needed to be evacuated first. I think a team was sent out to Chilliwack to kind of assess the patients there, and then provided transportation over. And as the weeks went on, and we had some peritoneal dialysis patients that were waiting to start peritoneal dialysis, were waiting for their training to start, but then couldn't make it out here for that training. And in order to avoid them getting into an emergency type scenario where they would need dialysis more urgently, I ended up taking like a route across that was accessible only to like healthcare providers or other essential workers. I drove out there and stayed in Chilliwack for about a week and did some training of patients in their own homes so that they could start doing, they already had the supplies there. And then I was able to do some training with them in their homes so that they could start doing their own dialysis. I trained someone also by Zoom who also had her own supplies in her home. And so we did some basic training by Zoom. She was quite technologically savvy, so that worked out well for her and allowed her to start doing some dialysis as well. So it was really just a bunch of ideas that me and my coworkers thought through and came up with solutions at the time. But now we know we've tried them, and then if another situation comes up, it's something that we could utilize again. But yeah, it definitely takes a team and lots of heads thinking.
Awesome. Another question that came in with registration, someone's saying home hemo is used by increasing numbers of PKD patients and depends on water quality and electrical service. Any comments on this would be valuable. And I guess for those who aren't aware, when you are doing home hemo, you usually have sort of an enhanced area where you have access to water. And of course, the machines need electricity, but are people who are being set up for home hemo, are they ever coached or given some information about what to do if your water suddenly doesn't work or your power suddenly goes out?
I don't know if you want me to take this one or if you want to, Sarah. We could both wear our other hats. So Sarah, also one of her many roles was being a home hemo training nurse. So you kind of, we've got all the bases covered between the three of us.
Yeah. Sure, I can start. So, and not just with that, another thing that often comes up that is not really labeled an emergency, but it is if you live in the area. We also have water advisories where there might be contaminations in the water, and we obviously don't want someone to dialyze using that water. So we do, as Dr. Bevilacqua mentioned at the beginning, we always sort of make sure our patients are aware that they may have to come back to a center to have the dialysis in a safe fashion. So if water is an issue in the area, or the power is kind of touch and go, we would really encourage those people to come back into the in-center where it's a much more stable place to receive the dialysis. I know we do a lot of work up front, and I can only speak to the BC experience, but we've done a lot of work up front to ensure that, you know, patients' water is sort of purified and goes through like whatever process it is. And we've been very creative in some of the water. We've had some patients who, you know, draw their water from rivers and lakes, and we want to make sure that's safe. So we do a lot of that work up front here in British Columbia. But I think if there was a big issue with a weather emergency, I think we would encourage those people to come to the hospital or community dialysis unit to have treatment, just because it's a bit more predictable with generators, and we're set up for that in our centers. But Dr. Mike, do you have anything else to add to that with your home hemo hat?
Yeah, no, I think that's perfect answer. And the only thing I would add, well, maybe a couple of things. So one, yes, people are routinely, actually a lot of the home hemo training is the what to do when things go wrong type of training. So this is definitely included in it. The other part I'd maybe add, I'm not sure the lay of the land across everywhere in Canada, but over the years, there have actually been a few different types of dialysis systems developed for people using the home. So different types of machines. And some, I'm not going to name names. I don't have stocks in anything or anything like that. But you know, some are better if, for example, you're in a place that's prone to power outages. You know, one has a good emergency battery that at least gives you a little bit of time. One does not. Some are better if, for example, you know, drawing on the water is an issue. Well, like there's one machine that uses a little bit less water compared to others. So these, if you live in an area where those types of things are concerned, it's good to talk to your team, because actually there might be a type of machine that's a better fit if one of those are a certain situation. Again, I won't name names, but it's good to know up front, and then you can kind of plan out for those things.
And the nice thing about our home dialysis patients is if they're at home, if there's a storm tonight, they could maybe possibly do dialysis the next day. It's not as quite of a tight schedule as our patients who come into a hospital, and, you know, their schedules. And so there is that as well. But yeah, just wanted to mention that.
No, that's a really excellent point, Sarah. And that's one of the reasons we say, for example, you know, you can't take more than a couple days off. Like at least in BC, we tell people, you know, you can't take more than 2 days off if you're doing home hemo. And one of the reasons it builds that in is that, well, what if something happens on that third day? You know, so that you do have a little bit of wiggle room in there. So that's a really, really good point.
Someone has asked, how long could a hemodialysis patient last in an emergency situation if they don't have access to assistance?
So this, who wants to take this
Go ahead,
again?
Mike.
And I was going to ask
Yeah.
Naomi how involved you
Well-
were. I'm sure you were very involved in this process when we had to do the triaging, right?
I wasn't so much involved at that time with the hemodialysis, but I certainly have those conversations now as I talk to hemodialysis patients about emergency planning. I don't think there's any, like, I mean, you could answer this question, Mike, that I don't think there's any specific time frame that we would say, but like you had mentioned, don't skip dialysis sessions, because then, you know, like, I mean, you don't know when that emergency is going to happen, right? And if you've already skipped one, then it kind of already sets you on a not so good trajectory. So making sure you go to all your appointments. And there should be, I'm sure your hemodialysis team or your kidney care team will have some kind of emergency diet plan so that it minimizes what your kidneys have to clear. You know, our critical things that we're looking at when we're not getting dialysis is potassium and fluid. Those are the things that are going to probably be the most critical most quickly. So minimizing those things temporarily is a significant part of that plan. I know in BC, although we are revisiting it, we have in Fraser Health here in BC anyway, we've always provided emergency medications for our hemo, well, not always, but recently we've provided emergency medications to help with potassium control. So that can be part of the plan as well. I would say a lot of it has to do with what other health issues you may have going on. That would be a significant part of that scenario.
Yeah, that was a perfect answer, Naomi, and you're exactly right. Those are the two big things, the fluid and the potassium. And so those steps Naomi just mentioned you can do at home to try to minimize it. And then, yeah, she was also exactly right when she said there is no number. There's no specific number. In other words, it's an individualized assessment. And what it plays into is how prone people are to those items. As Naomi just mentioned, what other health problems you might have. The other part that often plays into it is someone who's on dialysis, clearing those various fluid and toxins. It's kind of a combination of the dialysis and their own kidney function. So sometimes people with a little bit more of their own kidney function, have a little bit more wiggle room than someone who has zero kidney function, which is in the case in some polycystic patients, right? We do have polycystic patients who are on dialysis and have actually had nephrectomies, and by definition then have zero kidney function. So those play into it. But to kind of give a peek behind the scenes, why I was asking up front if Naomi was involved in the process, like for example, what happened at the flooding. This is where it's so important that you're in communication with your kidney team, is that in the hemodialysis unit, for example, we actually, in the whole region, we had to shuffle people around. So it wasn't just the one unit that was affected, where people had access. Actually, all of a sudden, even though, I'm over in Surrey and Naomi's in Abbotsford, if my unit has to absorb, 40 more people, obviously you can imagine that that's a big influx. So what we actually ended up going through is the teams actually went through patient by patient and made a determination of who really can't miss a dialysis treatment even one day because of those items, and prioritize those, as opposed to who's probably going to be, who's going to be okay if they have one day off. It's probably not going to make that big of a difference. And that's where knowing that the patients, and literally, I forget how many hundreds of patients we have in the region, but it was an exercise that when this emergency came up, we went through every single one and made that individual determination. So it's really an individual conversation with your team. And that's where being in such close contact with your team is so important, because from the patient perspective, there was contact with every single one of, okay, yes, you must be coming in today, versus, okay, with this going on, we're going to ask you to come in tomorrow so we can get this sicker person in today.
Something that I had not even thought about until now is if someone's doing peritoneal dialysis at home and for whatever reason cannot continue doing that at home, are they able to do peritoneal dialysis in a clinic?
Yeah,
that's definitely an option, Naomi. Yeah, I saw you.
Oh,
I
yes, I
waiting
can.
for me. I saw you slowly unmuting. Okay,
Me or Mike. We typically don't do that, but certainly we can make accommodations for that. Yes, I would say, I've had patients who come here, they haven't been trained yet, but they need to start dialysis immediately for whatever reason. And so we've done peritoneal dialysis for them in our unit, even though it's not open 24 hours a day. We would have them come in, try to do as many exchanges as is appropriate in the hours that we're open. And then they would come back multiple times a week for dialysis. It might not give them the best clearances, but it gives them enough clearance to kind of ward off needing to be admitted, if that makes sense.
Absolutely.
Yeah, and that's a situation where, if the team is doing it for them, where my head went with that one, and we've sometimes said the same thing with our home hemo patients. Again, even outside of an emergency, just in those hot weather and stuff. Actually, might sound bad, but because of the way climate's going, every summer we send out a reminder about this, because it's invariably going to happen that if your house, you haven't got air conditioning or something like that, and it's just too hot. In other words, you feel like this isn't a safe environment for you to be doing dialysis in. contact us and we'll figure something out. And so I would say the same thing about the peritoneal dialysis patients, because it's all where my mind went with your question was that, you know, not that we necessarily have to do it for them, but if they just frankly need a place because where they're at is not safe to be, I would say just
Yeah.
contact the team and they'll figure something out. That's the nice thing about PD is all you need is a pole and a bag. And so, you know, if it's just for physically to get you somewhere where that can happen, I'm sure any unit would be happy to help you out there.
Right. Now, one thing I know, and I assume it's with both home hemo and peritoneal dialysis, you have a huge stock of supplies to keep you going for a few weeks. And I know that if you're doing dialysis at home, they usually are keeping really good track of when you need a new shipment and that kind of thing. But I'm assuming that in the same case, if there has been some kind of an interruption in their ability to do dialysis because they run out of supplies, then I'm assuming, you know, finding a safer place and reaching out to their team to figure out where that might be would be helpful.
I also want to mention that one thing we do is it might not even be an emergency, but someone who lives in a rural and remote area, their machine may break down. And then that is an emergency to that person. So with those patients, we often send 2 hemodialysis machines to their home so that they can take that machine out and put the other one in. Because if they're living so rural and remote, and it could take days for them to get to an in-center or a metro center, that's another thing we always make sure. And we always send them home with a little bit extra, sometimes 2 months worth of supplies versus a month. Just knowing we live in Canada and there's often snowstorms and there's often, you know, things that impact that. I also want to highlight, which I didn't, but we all rely on the internet. And that's why it's so important for what Naomi mentioned, to have a list of your medications and a list of your medical history, because I don't know if anyone remembers, we had a crowd strike last summer where a lot of the hospitals couldn't get into our Microsoft. And then 2 or 3 years ago, Rogers Network went down in the Toronto and Ontario region. So if you show up to emergency and we can't access your data, it's good that you have a copy of that. That's really important to keep that in your wallet. And then the third thing I do want to mention is, think about, as you saw in our floods, the highways were closed. Sometimes there's one emergency route and everyone's trying to get to it. So if you are a patient receiving dialysis, make sure it's noted that you must be prioritized for transportation, because there's checkpoints and they're just, you know, they're not going to let everybody through. But if you have to get to that dialysis, and the same thing happened, everyone during our floods went to the higher ground where helicopters were waiting. Our dialysis patients got prioritization because they have a wallet card that says must be prioritized for transportation. So that's also something to think about in a disaster if highways are closed. Yeah, so just wanted to mention those ones.
Thank you. And I see we're sorry, go
Overtime?
ahead.
Oh, I was just going to make one more little plug just because it
Yeah.
reminded me when you brought that up in terms of the supplies. And this was covered earlier on the slides in terms of having 2 weeks. Home dialysis supplies also, and medications, both of them. I just want to make an extra plug because every now and again when we go and kind of, you know, ask people, are they doing this? And I see Naomi is there smiling. We find that, you know, sometimes that doesn't happen as much. And I think part of it is, you know, we're kind of spoiled. We live in an age where you can order something on Amazon and get it later that day or tomorrow or something. So sometimes people are used to doing things just in time. When it's one of these critical medications or critical supplies, it's just, you always need to be making sure you have that extra supply on hand. Don't wait till you're on your last pill to go to the pharmacy to get your refill. Make sure that, you know, you've done that in advance. So that's just my little plug, because we check every now and again, and some people are excellent, some people, you know, I know I might fall into that camp too. You know, you wait till you need the last thing and then that's when you pick it up. But when it's a critical thing, we need to always be ahead of the game.
Well, thank you so much, all of you. I am noticing we're just a little bit up, we're at our time. And I don't see any other questions right at the moment. Someone has said, thanks so much, very helpful in the comments. But I want to thank you all for taking the time today, for sharing this information. I think you've given us a lot to think about. And I hope that, what I'm hoping that all PKD patients and their caregivers take from this is that you need to really think individually about what you need to stay healthy and what you would do if you didn't have access to power or didn't have access, you couldn't travel, or, the number of list of things. And that often planning ahead can give you a little bit of peace of mind, rather than feeling like, I just don't know what's going to happen. So thank you all for being here. And I'll tell the people who are watching that the video for this session will be available online in the coming weeks, and we will send you an email to let you know when it's up. Thank you, everyone.
Thank you.
Thanks so much for having us.
Thank
Thank
you.
you.
Bye-bye.
Bye-bye.
Take care, everyone.